Hello everyone and welcome back. In this video, I'm going to talk to you about substance use disorders and specifically the epidemic or the unseen epidemic as this article refers to it among older adults. And I think when this article talks about older adults, it's talking about people that are, well, my age. I'm 59. And this is rather interesting because typically we get a call from a family and it's usually mom and dad that call us, and it's because there's an adult child, somewhere between 18 and 35 years of age in the family. Now, that's not every case, but that's sort of the bulk of them. Now, what this article is talking about, it says 1 in 11 adults over the age of 60, not quite me, but close, has a substance abuse disorder, according to 2022 data from the American Psychological Association. Now, what caught my eye about this was one, obviously, because I'm close in age. Two, I'm aware of, friends and colleagues that are having these issues, but apparently this is not that unusual. It says here, alcohol, marijuana, opioids, and prescription medications are major contributors to overdoses in older adults and substance use disorders, according to the National Institute of Drug Abuse. The disorders range from mild to severe. So really interesting. Now, as I mentioned, the bulk of our families are dealing with a young adult, but we do see some folks that are older, and it's not unusual for us to see certainly somebody over 50, closer to my age, and it's usually dealing with alcohol. Not every time, but a lot of the time. And it's somebody who started to drink perhaps early on, perhaps in college, and maybe, throughout their professional career. And perhaps it just started as something that was social. They'd go out for lunches and dinners, and part of the whole sort of, networking and schmoozing was, well, having a drink or having a couple of drinks, going out with the boys, that type of thing. And what tends to happen is that as you get older and you drink more, at some point it just reaches a tipping point, right, where it's out of control. And maybe some of these folks that they're talking about are people that have retired, people that have more time on their hands than perhaps they actually need. And I can just tell you, when I watched my own father's deterioration, now he was a little older than this. I mean, my dad had worked since he was 14, and within 18 months of him retiring, his late 70s, he was gone. And I think that sometimes you get to a certain age and you have more time on your hands than perhaps you're used to. I think this is the kind of thing that can happen. So if you are a family out there and you've got an older member of the family, perhaps it's an older sibling, perhaps it's a spouse. So if you're having that type of issue, we can help you. There's plenty of facilities that we work with that can help sort of the older type of clientele, right? You don't have to be sitting in group with an 18-year-old who's got tattoos and a nose ring. I appreciate that. So I'll put a link to this article in the description. If you have any comments or questions, or you have an older family member who's having issues, we'd like to talk to you. Maybe there are some options that are available, legal and non-legal, and we'd be happy to have that discussion with you. If you are having an issue in your family that I've not talked about, post a comment in the video. I'm happy to make a video for you about that issue, because if it's affecting your family, more likely than not, it's affecting somebody else's. And we want to make sure that families out there get the information that they need. So if you like the content, I'd love a thumbs up. If you want more of this content, which I put out on a daily, sometimes twice daily basis, please subscribe to the channel. I really would be grateful for that. And I'm enjoying this interaction with you. And with that said, I'll see you in the next video. Bye-bye.